Hey Glam Crew, it's your girl, Nikki the Glam Teacher. And today's video is going to be Know Before You Go, Part 2. I feel like there were a few things that I may have missed in that Know Before You Go for plastic surgery in the Dominican Republic. And I think the things that I missed were things that I thought were common sense or you should have known. But honestly, common sense is not so common, or we just don't know. No one ever told us, or there's so many things that we have to think about before we get plastic surgery that we just don't know. And there was recently a death with Dr. D. And I'm not going to be doctor bashing or anything like that. I don't do that. That's not my character. And you all should know that. If you're new here, know that. My returning subscribers, my glam crew, you guys know. Um, so pretty much there was a death with a Dr. D doll. And as I'm looking through the comments and the posts online, I'm just seeing all sorts of red flags. And I'm like, why didn't this person know? Or the people in the comments were just saying things and I'm like, well, that's pretty common. You didn't know that? So sometimes we just don't know. We just get so excited to have a flat stomach, a big butt, or whatever the case is, whatever it is that you're looking for. We just get so excited that we forget the most important stuff to know before we get on that plane and make our way over to the Dominican Republic. And I'm probably going to say DR throughout this video, which I'm referring to Dominican Republic, not doctor. Okay. Um, Now the first thing you should know, doctors not to go to. Okay. Don't I wouldn't refer these doctors to a dog. I wouldn't refer these doctors to a dog, y'all. I got a list of those doctors. Now, if your doctor happens to be one of those doctors and you've done your research, you got your heart set on this doctor, then do you. I am not here to tell you don't do this or do that. I'm just here to get my little bit of opinion. And that's exactly what it is, opinion. I have done some research on everything that I'm telling you all, but don't listen to just my words. When you're doing your research, you have to research everything, websites, fact check, reach out to the assistant, the doctor, ask past dolls, everything. And don't just think, oh, I want a doctor that doesn't have deaths, because you could be the first death. And don't think it cannot happen to you. You don't want to put that energy around you, but just know that is any surgery that you have, it can happen. Okay. Now I have been researching plastic surgery since 2013. Yeah. I started out with surgeons in Atlanta. I was just working out, doing good in the gym, and I came across some girl who was telling me about it. And I'm like, oh, let me go next door and, take a look. So I just had some stubborn fat that I couldn't really get rid of. And I went next door, got a quote from them, wasn't really interested. Okay. And then I went to a dermatologist who was doing plastic surgery in Atlanta. So be careful. And then years later, down the line, this same doctor in Atlanta, who was a dermatologist doing plastic surgeries, she was doing BBLs. She ended up on the news for so many things. A patient was brain dead. She botched different patients, so many different things. And if people had done their research and stuff on this lady, they would have realized she's a dermatologist. How could she possibly be doing these fat transfers? How much experience does she have? Let me reach out to her other dolls that she's done. I don't think in the US we call them dolls. Are we called dolls in the US? I don't know. Either way, but definitely reach out to other dolls and get their stories. A lot of things are not posted online. People are afraid to show their face, embarrassment. People are dealing with body dysphoria, and their friends, their place of employment doesn't know, and they just don't tell their stories, whether it's the good or the bad. So I've had people reach out to me. I've done different people on the phone, and they were just telling me things that they dealt with, and I was like, wow, like that was me. And you had surgery years ago. Like if I had talked to you prior to this and known, I possibly wouldn't have went to my first doctor. And my first doctor that I went to was Dr. Mannion. I went to him for his bedside manner, because from my experience and all the good stories that I heard in his Facebook group, he had good bedside manner. But He was getting really, really popular between 2018, 2019, and so many people were going to him. My doctor even had a death. He has two that I know of. Now, y'all, this was back a long time ago. I don't remember the names. I don't remember what link, where to find this exact information. I read it in a Facebook group, and he posted it on his personal Facebook and his Instagram. Now, I'm not about to scroll through his Instagram feed to point out, oh, here's the death so y'all can have proof. Y'all gonna have to do your own research. I just know at that time that I was researching, he had a few deaths at the time. And I like the way that he came out and said, okay, this is what happened. I'm so sorry that this happened. I'm cooperating with the family. We're going to get the body back to wherever it was from, blase, blase. But he didn't hide from it. He didn't take days and days to tell the public or reach out to the family. He didn't try to hide the fact and say, oh, it was an overdose or it was this, it was that. But right away, when things weren't right, he did what he was supposed to do as a doctor with good ethics, a good ethical doctor, shall I say. Now, when I was researching way back when, you know, that was just me. I was just kind of curious about it. I wasn't, for sure. Some people kind of just jump the gun and say, okay, well, they'll just say, okay, well, I'm going to get surgery. I have my money. 6 months down the line, they get surgery. They find a doctor that they think they love and don't look at other doctors. Look at other doctors, test the water out, do multiple quotes and interviews. Now, don't go putting deposits down with multiple people until you're sure that this is the one. You guys kind of just need to really dig back deep to 2015, 2016, 17, 18, and see what that doctor was up to. And you guys are probably going to be surprised at this list that I'm going to tell you about because I still haven't said that. So make sure you continue watching. But you're going to be surprised that Cabral is not on the list because we'll get to it. He didn't clean up his act. But, okay, so first thing you should know before you go is make sure you have an emergency contact. I said that in my first part 1 video. But your emergency contact should also know how to speak Spanish or can at least communicate a little bit in Spanish, or they have someone, a friend, a friend or someone associate who can speak Spanish and translate. Like if you call them up, they know, hey, I need you to translate, help me. Your emergency person should also have a passport. If they don't have a passport, how are they going to help you out of the country? In DR, their first language and primary language is Spanish. There's not a lot of people that know Spanish, guys. Glam crew. For instance, when I had came home from the clinic, and I came to the recovery house, right? And I was like hungry, hot, and dehydrated. And I'm coming into the recovery house, and they're like, hey, how are you? Da, da, da. And I'm sitting on the couch. I'm like, I don't feel right. I was hot from the ride home. I was hungry. I wanted to eat. Now, I can't clearly say all of that in Spanish. I'm hungry, feed me, I don't feel good. Well, I could. I really have to study my notes. It's been a long time. But I could easily remember comer. That's eat. So I'm telling them comer, 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 and I'm like doing hand motions, comer, and I'm just like, if y'all don't know, I passed out. Watch my past videos. I was like dizzy and woozy, and they're like, okay, come to the table. They understood, that I wanted to eat. So like, okay, come to the table. They're telling me this in Spanish, but they're like, trying to get me to go to the table to sit down and eat. So I'm at the table and I'm sitting there and they're like trying to find the one nurse out of all of the nurses that speak English. I don't know where she was, whatever. But like in this time, I'm like passed out. Then all of a sudden, this nurse come and she put alcohol pads and rubbing. I'm like, ooh, I came back, y'all. And so she spoke English. So she's like, are you okay? Do you want something to eat or drink? Da, da, da. Where did you go? What was your doctor? And I'm like, okay, I can talk to her. She can understand. And also I was telling them I was trying to eat. Yes, she's like, yeah, she translated, da, da, da. And she was like, yeah, good. Now, they brought the food. They knew what was up. In the midst of her trying to even talk to me and figure out what was going on that I needed, because I was able to communicate, comer, eat, they brought me food. So I ate and I was good. But there's so many other times I got lost at the mall. I didn't know how to get back to the recovery house. And I was like maybe 12 days post-op. But I was able to communicate to my taxi driver and give him directions on how to get to my recovery house because I didn't have service. Somehow my service went out. and I couldn't pull up Uber. I couldn't pull up my WhatsApp, but I found this man, thankfully, in this hoopty, and he got me back. And I was telling him where to go. Then when I saw the house, Aki, that means here, here. And he stopped the car and was like, and I'm like, Aki, that's So know before you go the address of where you're going, the recovery house. Some recovery houses don't give you the address until maybe 2 days of your arrival. And sometimes they don't even give you that. They just say, here's your driver, Pablo. Pablo looks like this, and send you a picture. He's going to be driving a Toyota RAV4. So here's the information. And you still don't know where that driver is taking you. I said, I need the address. Give me the address. When I got there, I needed the address. And I memorized that address. That way, if I knew I was going to be out. So if I was out and Pablo was late picking me up or something, boom, I can put in Uber. Or I could find a taxi driver and be like, this is the address of where I need to go. So that I wouldn't be lost and dependent and just looking crazy. Because when you look crazy, like you don't know what's going on, when you look crazy, that's when stuff's going to happen to you. People are going to see you're in distress. They are going to come up to you and play nice. Can I help you? No, I'm okay. No gracias. No gracias. And try to pronounce this stuff like you know what you're saying. You don't have to say a lot. Just no gracias. Okay, bam. Because when they realize you don't speak or understand Spanish, that's an opportunity for them to take even more advantage of you. Now everybody's not a bad person, but if you don't have like a good sense of character, then it just might not work out in your favor. You shouldn't take Uber and go places, especially post-op. Now, if you have a good sense of character, you got more than a little common sense, okay, go out and explore. You'll be okay. Also, know before you go. I'm looking at my notes, y'all. Your faja, if you've already had a round one, your faja can still be used for round two. So I have two fajas. And at first, I was letting the seamstress cut the material on the inside of the faja to make it smaller and get it taken in. Don't do that. I have stopped doing that. And so the material on one of my other fajas, I have a lot of material on it. And it's okay that the material's on the inside because you're putting on your foam, you're putting on your pads, your tank top, and all of that. So the indents from the extra fabric on your faja is not going to like put an indent on your skin or make you look odd. So keep your fajas. You can take them back. I went to Alexander Faja, and Alexander Faja will do alterations on your faja, either really cheap or free. I don't recall paying for them to take my faja in. Um, and so that's where I'm going to take my fajas back. And if I need the material to stretch out after round two, I have the material in my faja for that, just in case if I'm bigger. Or they can even bring it in and then cut off the material for me then. Okay, I'm running out of time, y'all. So keep your fajas, all right? Learn a little bit of Spanish. Your emergency contact should have a passport in case they need to come out to you and speak Spanish so that they can help translate. Also, your emergency contact, if it's your mom, your cousin, your best friend, your husband, um, they should know your overnight nurse's number. They should know the address to the clinic and hospital where your doctor is. They should know your doctor, your recovery house. They need a phone number for the recovery house, a phone number for your doctor, your doctor's assistant. I know you're like, that's a lot. No doctor's going to give me that information, blah, blah, blah. If your doctor or nurse, recovery house has any issue giving you that information, red flag. No, thank you. No, gracias. Red flag. Especially after you've paid your deposit. Now, trying to get all this information before you didn't put money down, that's bizarre. Now, pay your deposit. You decide this is your doctor. You pay your deposit. Now, you should be getting this information, especially if it's like within a week or two. I say 2 weeks within your surgery. You should have that information. Now, if your emergency contact is your husband, make sure your husband knows how to use WhatsApp and he has those numbers saved. And he tests those numbers out. Call and see if someone answers. Send a message and see if they respond. Pay attention to how long it takes for them to respond. Now, be mindful, there are other dolls there that are having surgery and may need top priority. But it shouldn't take 3 days to get a response checking in to make sure this number works. I say 24 to 48 hours is enough time. Longer than that, red flag. And I like to text on a Tuesday or Wednesday because Monday, the weekend just happened. They're busy. Boom. Some other tips to know before you go that I did not mention in my first video, my first part one of Know Before You Go. Um, Take a stool softener a few days before you go have surgery, especially a tummy tuck, because I believe they are moving like your intestines or something like that. They moving stuff around. Okay. So you might be a little backed up, your system gonna be a little out of whack. You don't want to have to push out a big ball, hard stool, and you just had the surgery and incision, you sitting here. Mm-mm. Take a stool softener, get Gas X, the for gas, because passing that gas hurts and it feels like oh, the medical term, I can't recall it right now. My head is a little jumbled, but it's like an air bubble in your chest and it's hard to breathe and really painful, and you think something extra is going on, but it's just gas. Take a Gas X pill. Don't eat a lot. I was eating, oof, I gained weight after surgery, y'all. In that recovery house, that food was good, and I was in there chowing down. Having someone cater to me, what? I was taking advantage, y'all. I was having a good time, and it was the best 18 days of. I had a good time at that recovery house, y'all. It was peaceful too, for some parts. So, Gas X. Um, Also take probiotics 2 days before you have your surgery. Probiotics, y'all. Because you're going to be given antibiotics, and those antibiotics for most women cause a yeast infection. So if you're taking probiotics, you're less likely to get a yeast infection, and you don't want to deal with all that pain down there on your womanly area after having surgery. Tip really quick to get your iron up: molasses, blackstrap molasses, liquid iron. I use Spatotone because it doesn't have alcohol in it. Liquid chlorophyll with orange juice. Take that, mix it up, you good. I just be a little bit of molasses, drops of chlorophyll, packet of the liquid iron, cup of orange juice, mix it up, and I drink that every morning. Now, if you're a healthy eater and you eat green leafy vegetables daily, 2 times a day, the daily recommendation, you should be good and not need that liquid chlorophyll, y'all. Another important tip: before you go out, make sure you pack a snack. If you're going for a post-op appointment or to get a massage, just know waiting is very common. And you might need a snack. If you know your massage, you're going out for your massage, and the recovery house does dinner between 5 and 7, and your massage is at 5 o'clock, and you're going to be hungry, make sure you get a sandwich. Ask the kitchen for a sandwich, peanut butter jelly, turkey and cheese, something. Grab a cookie, some water, juice. That way you're not out there in that traffic hungry and ready to pass out. Also, Glam Crew, make sure you bring something to entertain yourself, because at times it can get boring. So you might not have good service at your recovery house, okay? So what you're going to want to do is pre-download some movies and shows, bring a couple books, pre-download some music, because at those times when you're feeling down and maybe you reached out to your friend and they're not able to answer, you want to find something to entertain yourself, just to uplift your spirits, okay? If you can, go to the pharmacy and get your prescriptions that you may need beforehand. Now, some doctors will tell you, oh, he'll give that to you after surgery because it's individualized for you. Most of the time, they give you the same stuff as everybody else, just maybe a different dosage, or you might take it longer or less than someone else. But double check with your doctor. Always, your first person to check with is your doctor, okay? My doctor was not responding and didn't give me much information of anything. So I kind of just had to lean on the girls in recovery houses and what their doctor was telling them, and go based on past dolls helped out. Recovery house staff, what they saw was going on for the most part, like, oh, well, most doctors order this, order that. You don't need a prescription at the pharmacy. If you want pain pills, you can get pain pills at the pharmacy, just walk in. And I'm going to discuss that in my next video, which I will be going over surgery supplies, and I'll be giving details about what this cream is for, what that cream is for, what I used and what I saw help with other people in the recovery house. Don't be afraid to go by yourself, because there are going to be people from all over going through the same journey as you. And most people are willing to help. So don't be afraid. Okay, so as a round two doll, I think it's important to know you do not have to use the in house masseuse at your recovery house. And I kind of knew of this, um, but really, the in house masseuse, some of them are good, some of them are not. I found a massage place outside of my recovery house and I took Uber. Just know that the drivers do overcharge you. The recovery house drivers do. Excuse me. The recovery house drivers will try to overcharge you. Uber is really cheap and Uber is really safe. I took it when I was just days post op, did not have a problem at all. In my first Know Before You Go video, I emphasized the importance of having your post op massage therapist for when you come home already set up. I just want to re emphasize that is important, that you have your care set up before you go and come back. I just like to be extra cautious because I gotta make sure I'm together. You're investing all this money in your body. You want to make sure it goes right. So, to my list of doctors that I do not recommend, because a lot of people come to my email, come to my Instagram messages, and you guys are asking me, who do you recommend? Do you think this doctor is this? Will this doctor give me a vixen look? Blase, blase. All of that information is out here, guys. I even talk about it in some of my videos, past videos. So, before you come asking me questions, and I don't mind helping, but before you come asking me questions, make sure you watch the videos and the issue is not already addressed. Or you're going to the surgery groups, you're asking your doctor, or you're talking to past dolls that may have went to the doctor you're going to. Reach out to them and ask. I've been getting so much stuff, and even though I've been away, I still been answering questions, but it's a lot. And I almost feel like I'm about ready to start charging because it's a lot. I spend a lot of my free time reaching out and responding to dolls, and y'all taking this information serious because I'm ready to tussle. Y'all shouldn't be asking me this same stuff over and over. So let me just throw it on out there, y'all. Doctors, I do not recommend. Know this before you go. If you have a friend or family member that is about to go off and have surgery or thinking about it, tell them to just, hey girl, hey boy, I think you should. This girl, Nikki, the Glab teacher, she owns to something. She's talking about something. Here we go. So, Dr. Decenia. And if you go to this website, I have a video about this. It's called How to Find a Safe Doctor in the DR. I give you the website that you can go to and type in the doctor's name, and it'll come up with information. If he is board certified, if he or she has taken the additional training to get on this list, if they have, what qualifications they have, what hospital they work out of, and that should be a part of your research as well. The clinic that they're working out of, is it clean? Is it up to date? What type of equipment do they use? Do they have backup power supply? And I'm gonna do a video on that about my clinic that I went to. But that should be a part of your research. Don't just say, who's the safest doctor with no deaths? Your list gonna be real slim, real slim. But if your doctor that you pick is not on this website, type in SODOCIPRE.net, and you can translate that website to English. If your doctor is not on that website, definitely. Now I'm gonna give y'all an assignment. I'm gonna give you an assignment. I want you to drop in the comments the doctors that I name on the list. Which doctor is a part of this membership, the SOD accreditation? Which doctors are and which are not? I know which ones are not because I've looked. Now, Dr. Desena, Dr. D, Desena. Type that in. Is he on there? Maldonado. English is not my first language, y'all. Or Spanish is not my first language, y'all. Okay, so that's the doctor. Maldonado. I'm gonna type them doctors' names in right here. Okay, so see if he on the list, and you can put in the doctor's. I think it's the surname, like there might be other Dr. Decinas. So what you'll do is put in that name, and then it'll give you pictures. So the doctor that you're looking at, make sure it's the right one. Just like let's Mora. He's not on this list, but let's say Mora. There is an Angel Mora and a Jose Mora. There's two different people, but their name is still Mora. Dr. G, and I'm not even about to butcher that name. Dr. Garucci, Dr. G. There's two of them, and there might even be more. But look up your doctor's Instagram. See what the doctor looks like. You should know what the doctor looked like, y'all. And if his picture does not come up, the information about your doctor, red flag, definitely a red flag. So this list: Dr. Decina, Dr. Maldonado, Dr. Almazar, Dr. Malloy. I do not recommend them doctors. I would not recommend them to a dog. If you have already looked up this doctor and you're for sure this is who you want to go to, that's your business. My surgery sister from last year, I love her, y'all. Her body looked bomb. She went to the Cena and came out. Some of these dogs look good, no problems. But then there's those few that, like I said, hide in the background. They're embarrassed, they're ashamed. They just don't want to be exploited and into all of this drama. Like, I get hate mail. And I'm just like, what? Me? I get hate mail from people just like, oh, why did you say this? That's not right. You need to check your information and blase, blase. Well, guess what? I didn't told you I'm not a doctor. I'm not a psychiatrist. I'm not a nutrition. I'm not a surgery consultant. Yeah, we'll see. I'm not a round five person with 10 years of experience and whatnot in this surgery world. I have had mentors that have been doing this, that are nurses. I have had past friends, family that have gone through DR, US surgeries. Either way, you can listen to my 2 cents and then go do your research further. So get this 2 cents, then add your 2 cents to it. And guess what? We got 4 cents. We about to have a dime soon. A whole dime. All right. So, I almost want to put on this list Dr. Mercedes. My surgery sister that went to the Cena, she was with Mercedes last year. And he still did her body bomb. Now, some people, they just take the risk. And those people that do take the risk, they know their body. They haven't had prior health conditions. They're not weight loss patients. They're not on some crazy strict diet or any medicine. They're not diabetic. They've had surgery before, and this is not their first round, and they kind of just know their body reacts well to anesthesia. So take that into consideration. Use some common sense. Seriously, take those things into consideration, y'all. But I almost want to put Mercedes on this list, and I want to put St. Patrick on this list and Cabral. But those three doctors have really cleaned up their act. Now, back in 2017, 18, summer 19, those three doctors did not have good years, okay? Do your research on that. Some Facebook groups still have that information up. Some groups have been closed, and a lot of this information is not available. There was a crazy lady whose daughter had got, who passed somehow. I can't remember the exact details, but she was on a mission to get Facebook surgery groups closed and all of this information shut down because she was heartbroken over what happened to her daughter. And instead of having information out there for people to know and be warned about, a lot of that information just disappeared. And so now people are starting from scratch and they're like, oh, I haven't heard any deaths from Cabral. It's 2022 and it's only April 2022. We're 4 months in. I don't think he has had a death this year. And people are like, oh, he doesn't have deaths. He's a good doctor. Deaths do not mean you're a good or bad doctor. It happens, guys. It happens. It happens. Because y'all ain't about to have these folks coming at me like I'm crazy. And I'm just trying to share some information for you to go research and form your own opinion. But doctors do clean up their reputations. They get better staff. They get better lab companies. They do deeper testing. So that's why these doctors are not on my do not recommend list. I would recommend you get on this website, the SODOCIPRE.net, and research. I really do hope this video helps some people. Share it. Continue to send me your love and your hate. I will respond accordingly. Drop in the comments which doctors y'all found on the list and which was not. Because I want somebody else to tell me some information, because I just want to know, are y'all actually looking up this information? Next video is going to be my surgery supply list, and then after that, your girl gonna be gone. Round 2. Ooh. Bye, Glam Crew. Thank you for watching and take care.